Hi everyone, this is Simran. Welcome back to our Denial Management Learning series. In this session, we will talk about CO-50, Medical Necessity Denial, one of the most critical and frequently asked denials in medical billing and AR interviews. By the end of this video, you will clearly understand what CO-50 actually means, why insurance companies deny claims as not medically necessary, and how an AR caller decides whether the denial is correct or incorrectly applied. I will also explain which documents you must review, the payer policy logic behind this denial, and when you should appeal and when you should not. So, let us start with a question. What is CO-50 denial? CO-50 denial means the payer or the insurance company denied your submitted claim because they believe the treatment, procedure, or service you performed does not meet their medical necessity criteria based on the patient's condition or the payer's coverage guidelines. In simple words, the payer believes the services you performed do not match or are not justified by the patient's diagnosis, condition, or coverage rules. And the insurance company made this decision based on medical records, diagnosis code or ICD-10, procedure code such as CPT or HCPCS code, payer medical policies like LCD or NCD rule. Now, let us clearly understand what medical necessity means. Medical necessity means the service you performed must be genuinely required to diagnose, evaluate, or treat the patient's medical condition. In simple terms, the service must be clinically appropriate for the patient's condition, supported by symptoms, signs, or abnormal findings. Clearly documented by the provider in the medical records, allowed under the payer's medical policy, such as LCD or NCD. If any one of these elements is missing, the insurance company may deny the claim as a CO-50, medical necessity denial. For example, imagine two patients receive the same ECG test. Patient 1 gets an ECG without chest pain, shortness of breath, or any related symptoms. Patient 2 gets an ECG due to active chest pain and other cardiac-related symptoms. In this situation, the insurance company denies patient 1's claim as a CO-50 denial because the ECG was performed without supporting symptoms and does not meet medical necessity requirements. However, patient 2's claim is payable because the ECG is clearly supported by documented symptoms and meets the payer's medical necessity guidelines. Now, let us uncover the CO-50 denial reasons, why it happens. In real AR work, there are 3 common reasons when an insurance company may deny your claim as a CO-50, medical necessity denial. Let's start with the first and most common reason. Reason 1. Diagnosis and procedure do not match. Most of the time, you build the correct procedure or CPT code, but if the diagnosis code does not justify the procedure you performed, the insurance company will deny your claim as a CO-50, medical necessity denial. For example, when the provider performs a chest X-ray, but the claim is billed with an ankle sprain diagnosis code, even though the chest X-ray procedure itself is correct, the diagnosis does not support it. Because of this mismatch, the insurance company's system immediately denies the claim as not medically necessary. This is one of the most common reasons AR callers see as CO-50 denial in daily billing work. Reason 2. Incorrect or weak documentation. In many cases, the doctor may perform the procedure or service, but their medical notes do not clearly explain why the service was required. When the service's reason is not documented correctly, the insurance company cannot determine whether it is medically necessary. As a result, the payer may deny the claim as a CO-50, service not medically necessary denial. This is because insurance companies do not pay based on assumptions. They pay based on documentation. Reason 3. Diagnosis is not approved under LCD or NCD guidelines. Let me explain this in a simple way. Insurance companies do not decide medical necessity randomly. They follow strict coverage policies. These policies are called National Coverage Determination or NCD and Local Coverage Determination or LCD. When a service is billed, the payer checks one thing first. Does the diagnosis meet the LCD or NCD rules? If the diagnosis is not approved under these guidelines, the insurance company will not consider the service medically necessary. And because of that, the claim gets denied as a CO-50 medical necessity denial. In simple words, even if the procedure was done correctly, if it does not match LCD or NCD rules, the payer will not pay. Now let us learn how to handle CO-50 medical necessity denial, step by step, like a professional AR caller. When you receive a CO-50 denial, your first step is review the EOB or ERA carefully and identify the exact reason for the denial. Do not assume anything. When reading the EOB or ERA, you must check CPT code, diagnosis code, adjustment reason, and remark codes. These details tell you the real story behind the denial, but you must pay close attention to the remark codes because remark codes clearly tell you whether the denial is based on NCD policy or LCD policy. This step helps you understand why the payer denied your claim and guides you on what action to take next. Now let's move to step 2, verify medical records. Open the medical records and review them very carefully. Do not rush this step, because this step clearly tells you one thing, whether the CO-50 denial is valid or appealable. Now check the records one by one. First, is the diagnosis clearly documented? Second, do the symptoms support the service performed? Third, has the provider clearly explained medical necessity? And fourth, does the procedure match the patient's condition? If the medical records do not support the service, then the CO-50 denial is actually valid. But if the medical records clearly support the service, then this denial becomes appealable, and you should submit the claim for reconsideration with proper documentation. Now move to the third step. Review the LCD or NCD policy carefully. This policy clearly tells you one thing, what the payer will cover and what they will not. Go through the policy line by line and confirm. First, is the CPT code covered under this policy? Second, which diagnosis codes are allowed? Third, are there any frequency limits or service restrictions? If the diagnosis appears in the approved diagnosis list, you may correct the diagnosis if required and submit the claim for reconsideration or appeal. But remember, this completely depends on the payer. Some payers accept a corrected claim, others require a formal appeal with proper supporting documentation. Step 4. Submit an appeal. This step is very important. As an AR caller, you should never appeal every CO-50 denial blindly. You can submit an appeal only if the service is covered under the payer policy. Medical necessity is clearly documented in the records. Coding is accurate and matches the documentation. The payer policy supports payment. When you submit the appeal, always attach complete medical records, policy reference LCD or NCD that supports the service, a clear and professional appeal explanation. If the payer policy does not cover the service, do not submit an appeal, because in this situation the denial is valid. When coverage is not available, you must strictly follow the client policy. Based on the client guidelines, either transfer the balance to the patient's responsibility or write off the charges as required under the contract. Always remember, no coverage means no appeal. Now you clearly understand what CO-50 actually means, why insurance companies apply it, and how a professional AR caller resolves it without wasting time on unnecessary appeals. If you want to master claim denials and grow as an expert AR caller, this playlist is for you. I teach 30+ common medical claim denials step by step, with real payer logic and job-focused techniques. No theory, no confusion, only practical denial management skills you can use immediately. Follow this playlist to learn denials correctly, fix them properly, and prevent them from coming back. Subscribe to this channel and turn on notifications so you get my videos first. If you want job updates and hands-on training material, join my WhatsApp group, link given in the description.